The second part of our series on cardiothoracic surgery deals with the thoracic cavity and the respiratory system. In this video, we will review the anatomy involved. Major structures of the thoracic cavity are the heart and its great vessels, trachea, esophagus, lungs, and the bronchial tree. Thoracic cavity structures are bordered by the sternum, ribs and spine, and diaphragm. The thoracic cavity has two divisions. The right pleural cavity contains a lung with 3 lobes. The left pleural cavity contains a lung with just 2 lobes. In the center of the chest, between the lungs, is another space called the mediastinal cavity. The pericardial portion is the heart, and the superior mediastinal cavity contains the trachea and esophagus. One additional structure within the mediastinal cavity is the thymus gland that plays a role in the endocrine system. To begin, let's review the bony structures that border the thoracic cavity. The sternum is located along the midline and has 3 main parts: the manubrium, the body, and the xiphoid process. 12 pairs of ribs surround the thoracic cavity, including 7 true ribs with a direct connection to the sternum, and 5 false ribs that have only a cartilaginous connection, or in the case of the 11th and 12th ribs, no connection to the sternum at all. Posteriorly, all 12 ribs have direct connections with a corresponding vertebra. This forms an effective cage which protects the vital structures beneath, yet allows for expansion of the chest wall for respirations. The lungs rest on a large flat muscle called the diaphragm. They are surrounded by a double-layered serous membrane called pleura. The inner layer, or visceral pleura, lines the lungs. The outer layer is the parietal pleura that lines the chest wall. The space in between is known as the pleural space and is filled with serous fluid. The fluid prevents friction during respiration. It's easy to make a comparison between the pleura and the serous pericardium of the heart. Respirations, or breathing, is achieved by principal muscles such as the diaphragm, the intercostal muscles between the ribs, and the abdominal muscles. Accessory muscles are the sternocleidomastoid and scalene of the neck. As muscles contract, the ribs and sternum elevate, creating space in the thoracic cavity and decreasing pressure. The decrease in pulmonary pressure forces air into the lungs. As the muscles relax, the air is forced back out through the upper respiratory tract. The right and left phrenic nerves are spinal nerves which travel through the thoracic cavity and innervate the diaphragm. The protection of this nerve becomes very important during many cardiothoracic procedures in order to preserve normal respiratory function. The lower respiratory tract includes the trachea and the bronchial tree. The trachea or windpipe is located in front of the esophagus. It joins the cricoid cartilage and is followed by 15 to 20 C-shaped pieces of hyaline cartilage. The most inferior cartilage in the trachea is the carina. The bronchial tree has right and left main stem bronchi. The right bronchi is longer in length and wider in diameter. The left bronchi branches with a greater angle deviation, which is why foreign objects have a tendency to become lodged on the left side. Each bronchi leads to a lung. Both the trachea and the bronchi are lined with ciliated mucosa to trap foreign particles. Alveoli is where the exchange of gases occur in the lungs. Branches of the pulmonary artery bring deoxygenated blood to the alveoli. CO2 leaves the blood and oxygen goes in. Blood is returned to the left side of the heart via the pulmonary veins. A cluster of alveoli is located distal to each bronchiole and is called alveolar sacs. Lung tissue is friable. In the illustration, we notice that the right lung has 3 separate lobes, whereas the left lung has only 2 lobes. The hilum of the lungs is where the main bronchi, the pulmonary arteries and veins, and the lymphatic vessels enter the lungs on the medial surface.